What are some of the questions you get from patients when you tell them that they're going to need radiation therapy? Are they frightened by that?
Sure. Well, many people don't have a lot of exposure to radiation oncology, which is the therapeutic delivery of radiation, whereas most people at some point in their life have had diagnostic radiology at some point, whether it's a chest x-ray or mammography. So much of our discussion regarding the technical aspects is really just what is the radiation that we're delivering, how do we do it, and what is the experience. Certainly one of the questions we're asked a lot is, will I be radioactive? For breast radiation, the most common ways we do it, the answer is no, you will not be radioactive. No superpowers, unfortunately. But essentially it tends to be a well-tolerated treatment, and as the early stage breast cancers tend to receive several weeks of therapy, we meet with them routinely and we get to know each other, and it's a wonderful patient-physician relationship that we can develop.
Side effects to radiation after they go home?
Absolutely. So radiation therapy for early stage breast cancer is delivered in the outpatient setting. So for those several weeks, it's about a 20-minute session each day. The side effects early on are minimal, but what we do, the reason why it takes so long, is we give a little dose each day. And we do that because that's tough on the tumor, but easier on the healthy tissues that we're trying to protect. And so early on, there aren't many symptoms, but then many women will develop skin irritation, possibly some fatigue. That's why it's absolutely essential that we meet with them. When we have to treat more aggressively, sometimes shortness of breath, or some pain with swallowing can be an issue as well, depending on how aggressively we have to treat the lymph node basins. But for these relatively short courses of radiation therapy, it tends to be well tolerated, maybe with some swelling of the breast and pain.